Thanks, Charles.
Okay. Well, my next guest says this debate isn't even about health care. It's about political power. Republican Congressman Michael Burgess practiced medicine for 25 years, and the congressman says that the only thing that the president wants out of this is power, apparently, and control. Am I right? Am I stating what your concerns are about this thing, Congressman?
Correct, and I think you said it during your opening statements that this is all about the president getting to be able to sign a bill ostensibly before the State of the Union address, which would be about the one-year mark that from which he took office, and be able to lay claim to a major policy victory during his first year. Unfortunately, there's just not much about what we're talking about right now that has much of anything to do with health care, with all due respect to my friend from Pennsylvania, who I do respect. I don't know that there's the cost containment that he alludes to in the Senate bill. It's just not there. What we're talking about is ratcheting back payments to providers, payments to hospitals, taxing insurance policies. I don't know that that's the kind of cost containment that's going to get us where we need to go. What it's likely to do is to unbalance the system even more. And as we all know, there are some serious deficiencies within the system that need to be fixed, but we're not talking about fixing those. I mean, the pre-existing conditions that Representative Altmaier alluded to, that didn't happen until 2014. We could fix that before the end of the month, December, if we wanted to. It's pretty straightforward. The Congressional Budget Office scored that bill at about a $25 billion cost over 10 years. That's a far cry less than the $1 to $2 trillion we're talking about here. And for the life of me, I don't understand why, after the August recess, when the American people were so upset with what we were doing, with this 1,000-page bill that we laid before them, and they said, no way, I thought we'd hit the reset button or the pause or the slow down button. Instead, we hit the full speed ahead button. We increased it to a 2,000-page bill. Well, we said we won't take it ourselves. We're not going to take the time to read it, but we just want you to be happy with it.
Congressman, it's sort of frightening what you're saying. You're saying that this was just pushed through so that it could be something of a campaign slogan in the future, despite the cost, despite the risk, and despite the uncertainties.
It appears that is largely the case. Again, I sat and listened to the amendment being read on the Senate floor on Saturday afternoon. It didn't have anything to do with health care. It had all to do about control, and control over people's lives and control over people's dollars. This is a bill that is about control, fundamentally. It is not a bill that's about health care. If we wanted to improve access to health care, there are plenty of things at our disposal. We've talked about the Met length. We're talking about selling across state lines. We talk about extending some of the ERISA protections for pre-existing conditions to people in the individual insurance market. How about allowing people to consolidate a market that across state lines, like doctors' offices, realtors, chambers of commerce, who might have a similar business model where their employees could all benefit from that type of plan and bring the cost down through competition. But we don't do that. We talk about forcing in this government option, or how about the ultimate government option is what they've done now in Nebraska, to say the federal government's going to be responsible for the whole cost, and we'll just pick up the tab for Medicaid in Nebraska. This isn't like giving an overpass to someone to buy their vote. This is giving an entitlement to a senator, to a whole state to buy their vote. That's incredible. I don't know that anyone's ever seen anything quite like that before.
So having said all of these things, once the smoke clears, we're still going to be back at square one with respect to the quality of care, and perhaps even go back a few pegs then.
Possibly, but I wasn't there in '93 and '94 when this was tried before and didn't make it across the finish line. But actually, some good things happened in the next couple of years. The S-chip program, some people argue whether that was good or not, but nevertheless, it passed the Republican Congress. Certainly, the furtherance of health savings accounts, medical savings accounts that started in '96 or '97 were improved in 2003 in the Medicare Modernization Act. These things have gone a long way towards helping people be in charge of their own health care dollars, and actually putting them in charge of health decisions. And ultimately, if we don't remove the middleman, there's no incentive for people to hold down costs. If someone else is paying for it, sure, I want all you got. Health care, yeah, give it to me, because it's not my bill ultimately.
Congressman Burgess, thanks a lot. Merry Christmas, and thanks for being on the show.
Merry Christmas to you and your listeners. Interesting year ahead for next year.
Absolutely. Well,